Professor, what are people there saying about this latest outbreak of bird flu in China?
Well, I have a chance actually to speak to some government officials, scholars, and also ordinary people in China. And obviously, everybody is concerned. Some are worried, but few actually panic.
And now, Professor, I read over the weekend, and I'm sure you've seen the same information, that there are some signs that perhaps this is a strain of bird flu that could be transmitted through the air. It could be an airborne illness, which would seem to suggest that it has much more propensity, perhaps, to infect people and ultimately, again, not to sound alarmist, but cause an epidemic. What do you know about that quality of the virus thus far?
Well, so far we have 21 cases with 7 deaths. So the case fatality rate is about 33%. So that is still not as high as the death rate for H7N9, even though it developed the capability to be infected in airborne means.
Since it could potentially be airborne, what are neighboring countries doing to possibly prepare for the outbreak, outside of China?
Well, so far, the World Health Organization does not recommend countries to take any particular measures to limit travel. But we have seen some East Asian neighbors of China, like Japan and South Korea, are already instituting thermal scanners to screen people with high temperature at the airports.
Professor, is China, in your opinion, thus far doing an adequate job dealing with this outbreak? And in general, are the Chinese getting better at it the more familiar they become with the way that bird flu tends to spread?
I won't say they have done an adequate job in responding to the outbreak, but I would say compared to 10 years ago during the SARS outbreak, they have done obviously a much better job in terms of reporting the disease situation, in terms of responding to the outbreak.